When medical schools don't teach about menopause and hormones, and when research that is bad is published and believed to be common knowledge and is outdated, this is what happens. So let's look at a research article that talks actually exactly about this. In this article from 2019, they are answering your exact question. So let's get into it. So the history of hormone replacement therapy started in the 1960s, and then there were some interesting things that happened. So hormone replacement therapy got popular in the 90s, and then the Women's Health Initiative started in 2002, and this is where it gets real dicey. They released information that said that hormone replacement therapy was more detrimental than beneficial effects, so hormone replacement therapy was dropped. The negative effects of this study are so unbelievable. That is why your healthcare provider still believes that. Now, hear me out. There are new guidelines, and there are doctors that you should see that are updated in education. And this is why I recommend people go to the North American Menopause Society. If you want your hormones tested, please find a healthcare provider that has updated knowledge. Because if you study menopause and perimenopause, you would know this article. Okay? So, no offense to the people that want to hate, but let's continue reading. So their bad research created panic, but look below. In the following years, a reanalysis of the Women's Health Initiative trial was performed, and new studies showed that the use of HRT in younger women had a beneficial effect on cardiovascular systems, reducing coronary artery disease and all causes of mortality. It reduces the risk of cardiovascular disease, not increases. So the FDA initially only approved HRT for the treatment of hot flashes and not for the prevention of other treatments, but they later then added that osteoporosis should be included, and that is true. That is very true. Later on in more studies that they found that HRT had a positive benefit in women with lots of things, not just menopausal symptoms. So the incidence of cardiovascular disease increases in menopausal women. Because cardiovascular disease increases in menopausal women, they have found in clinical studies, here it is, that have shown HRT favorably impacts the risk factors. Favorably impacts meaning helps you. The clinical efficacy could be related to early treatment, but also because of the administered HRT to those with higher cardiovascular risk due to their symptoms. And this is why I want you to see a doctor who understands all of you. And this is why you've got to fight for your health, because old information equals bad care. We must have mental flexibility. We must continue to evolve. And we all know women's health is behind. Hit the plus sign and follow for more women's health and wellness tips. Bye.